good evening, and Happy New Year, and welcome to this live webinar where I'm going to tell you all about Ellacor. I'm Dr. Simona Pautler. I am a board-certified plastic surgeon, and this is my Ellacor device. And for the next hour, I'll be telling you everything you need to know about this exciting new technology, which I introduced into my practice a few months ago, having had the treatment myself. Please stay for the whole hour, because at the end, after we show you some videos and present all the information, you'll be able to submit questions and we will be answering those live for you. This is actually a vacuum unit, and it is not a laser. This device has a special cartridge attached that has little needles, and it suctions up the skin a little bit, and little needles go into the skin and little cores are removed. And each of those little cores are so small that they don't leave a scar, and they heal within about a day or so. And as all of those little cores heal, the skin gets tightened. This was a natural complement to my surgical practice. Now, I remove surgery with a scalpel on the breast, on the tummy, on the face. Actually, pieces of skin get removed. This Ellacor can be done in the operating room. It can also be done in the office. And the little cores remove skin, and per square centimeter, you can remove up to 8%. And the depth is about 4 millimeters. Now, for thinner areas, you can gauge the depth a little bit more superficial. And so that is how the skin is tightened, by removal of little cores of tissue. And it's a great alternative. It's not a substitute for surgery, but there's no incision, there's no scar, because the cores are so little that they heal with a scar-free result. The best candidates for this procedure are those who really are not interested in surgery, or who are having surgery but need skin tightening in an area where there's no really good place to put a scar. Now, originally, Ellacor was designed for the perioral area. That's where we got our first FDA clearance for this area. Now we've branched out. You can do the neck, you can do the chest, you can do the stomach, you can do the arms, you can do the above the knees. And it's hard to do an incision above the knees. It's really hard to do incision on the arm. Like, you can do one of these, but a lot of patients don't want that. So Ellacor can be used in a lot of areas on the body. And again, if patient's not ready for surgery. Now, surgery is instant. You get a lot of skin removed, but there's a lot of recovery too. Ellacor is a little different. It is not a substitute for surgery. It's a process. Most patients need 2 treatments, sometimes 3 or more. Remember, the most you can remove in any one area is 8% of skin. Multiply that by 3, that's 24% of skin. That's quite a bit, but it's a process. You have a treatment, you got to wait and heal. 10 to 12 weeks later, you can do it again. You have to have some skin intact between the little holes so that you can heal. You can't overwhelm the skin all at once. A lot of patients are GLP-1 patients who have lost a lot of body fat. Most of the skin excess on their bodies is taken care of with surgery, but there's some areas where surgery is not really ideal, like above the knees and the other areas that I talked about. Now, a key thing to remember is that every little core stimulates collagen production. So collagen production really maximizes at around 90 days, 3 months. And that's why waiting 3 months in between is sometimes better than overwhelming the skin and doing the treatments a little too quickly. So that is why The patients who want to get Ellacor, you need patience, you need time. The patients need patience. You can't do it all at once like with surgery. So it is a process. It's a process you have to trust because it does work. And the collagen tightening and remodeling seems to take place even long after the procedures are done. So what is the downtime after you've had one of these treatments? It's area specific. So I had my face done in the summer. I had to wear sunscreen, of course. After about a week, I stayed out of the sun. And it's painless. It felt a little dry, a little tight. So I used a non-greasy, like I used an exosome treatment for this. Applied it twice a day. I wore makeup in about a week. And I had my stomach done twice already. And I only used a topical anesthetic. And because you wear clothes, we put like a Tegaderm, like a saran wrap, a sterile saran wrap, which I kept on for about 6 hours. And then I peeled it off. That was probably the worst, is peeling off the occlusive dressing. And took a shower that night. And I used a non-oily type of lotion on my stomach as well. Didn't exercise that day. Exercised 2 days later, and it was dry. It's a little itchy. It flakes a little bit. But there really isn't a whole lot of downtime. Body is easy. You can cover it with clothes. The face is a little bit different. It's a little pink for a while. It almost looks like little red squares, like cupping. Like cupping puts a little red circle where you have it because there's a strong suction. This is not nearly as strong. The suction is a lot weaker, but there's little red squares. They're red, then they turn pink and a little bit brown, and you have to use your whatever. We prescribe plated. It's an exosome treatment. We have our patients use it. There are some patients that stay pink for longer, so we give everybody a light steroid lotion to start putting on twice a day on day 3 after the procedure. Makeup 5 to 7 days. Best results are seen about 3 months after the treatment. That's why we do encourage waiting about 90 days before you have a second or third treatment. The body, you can probably do the treatments a little bit closer together, but for the face, we do recommend waiting about 90 days. Again, this is not surgery. It's a process. The results aren't instant, but then you don't have to worry about the operating room. You don't have to worry about anesthesia risks. You can't get a nerve injury. It's really unlikely to get an infection unless you have a history of cold sores. That is when you have to use some Valtrex pre and after the treatment.
Hi everyone, I'm Julia. I'm a PA with Dr. Pautler, and I am going to be doing a lot of our Ellacor treatments. This is our beautiful patient, Patricia. She is a perfect Ellacor candidate. I just want to point out where we would do Ellacor on Patricia and why it is so good for her. So she would be perfect for having Ellacor right around her mouth in the perioral area. So she is, what's your age? 58 years old. So she, at this point, could opt to have a facelift, but we could also keep the facelift, push it off, or actually even avoid the facelift by doing multiple Ellacor treatments. See these little fine lines here? And her nasolabial folds, all these ones around her mouth. Not that she has a ton, but she has some that actually these can't even be treated with a facelift. So if we lifted here, we get the nice cheek lift. We can get a neck lift with a facelift, but pucker your lips for me. See how she still has the fine lines around her lips, and then relax. And again, there's still fine lines there even with that pull. Facelifts do not address the perioral area. So Ellacor is perfect alone by itself for a treatment, or even combined with a facelift. It will take away these little fine lines. It will soften them. And you can even see that she has great tone, the muscle tone in her neck. So that would be another reason we don't really want to do a facelift on her, because we don't really need to worry about the muscle repair, but she does have a little bit of looseness here that the Ellacor could tighten very nicely with no scarring, no real downtime, very minimal downtime for her. You can turn to the side a little bit, you can see there. So see that little bit of skin? That would tighten that all up too. Take away all those fine lines. She is just a perfect candidate for our Ellacor. Probably 2 to 3 treatments would do a great job on her.
Hi, I'm Dr. Pautler, and I had Ellacor on my stomach. You can see on my Instagram the procedure being done. There was a little bit of blood on it. It's painless. And I had it 5 days ago on a Saturday, and today is Thursday. I've already been exercising. I've been to the gym. I almost forgot I had it. It itches a little bit, but it's really not that bad. This is 5 days out. It's a little pink, a little dry and flaky, but I can't wait to do it again because it was so easy. My physician assistant did it for me, and I'm going to have more treatments because I don't want a tummy tuck, but I just want this skin tightened, and this is perfect for me. It's coming along great.
I'm Linda Lopez, and I just had the Ellacor procedure done, about 3 weeks ago, a little bit longer. Dr. Simona Pautler had done it, and we focused on my lower face. The downtime was the same day I was actually shopping with my boyfriend, with a scarf on my face. So for me, there wasn't a big downtime. But I think by day 3, I really could not have anything covering my face. Very happy so far. I'm happy with the way it's softened to the sides. I'm going to do another treatment, possibly 2, and I'm focusing on some jowls that are forming. So I'd like to just soften that area, and I believe it's going to happen. So thank you.
Thank you for attending our webinar for Ellacor. We hope that you found the information useful. Remember a few key things. First, Ellacor is not a specific wrinkle remover. It is a system of skin tightening through skin removal through micro-coring without an incision and without scars. One treatment is rarely enough. You usually need 2 or 3, sometimes more. Now, the stimulation of collagen and elastin is very, very strong, and it continues for up to 9 months after your treatment. So the key with this is patience. You need to space your treatments out about 12 weeks. For our webinar attendees, we were going to also offer you an extra 15% discount for any kind of package that you purchase after seeing this webinar. So make sure you check your texts after this webinar, and that way you can book your consultation with us. And don't go away for the next 15 minutes or so. We have a chat box. You can submit your questions, and we're here to answer all of your questions live. Good night.